Health Matters podcast. I'm absolutely delighted to welcome Dr. Mariah Whitney, who's going to talk to us about arthritis. Now, a lot of our listeners are familiar with arthritis, but I know I'd appreciate a recap, especially because most of the news stories out there say that, even though it's becoming more common, people aren't seeking the help that they need. Why is that?
Thank you for having me and Ricky, and yes, I'd be delighted to clear up any misconceptions. First of all, arthritis is an inflammatory disease of the joints that occurs mostly on knee joints or joints on the fingers, among others. The inflammation is often accompanied by pain and irritation in the joints. As you mentioned, most people don't realize they have it, and instead describe their situations that they just started feeling pain and hotness in their bones. At first, they assumed that taking some over-the-counter drugs to relieve pain would suffice, but they find that with time, their problems progress to the point that they can't walk without help, or sometimes even at all. It is usually at that point that they decide to call for help and make an appointment to see a specialist like myself.
Okay, you know when most people think of arthritis, they think of osteoarthritis, but there are many forms, and it affects every aspect of sufferers' everyday lives, doesn't it?
That's true. In fact, arthritis has affected many people all over the world, and in all aspects of life. According to BBC News, it was reported that according to a recent survey within the UK, many people with arthritis reported losing their jobs due to complications from the disease. The majority reported missing days of work due to the pain they were experiencing, as well as other symptoms. Just to put it in context, more than 600,000 people with arthritis miss going to work annually in Britain. However, the total number of people diagnosed with arthritis each year is over 10 million. As high as the number is, it is anticipated to rise in the future. Still, there seems to be some trepidation about involving employers or HR in the management of workers' condition. One of the main reasons that some may choose not to disclose their condition is due to embarrassment that they are suffering from an illness that typically affects older workers. Another reason for the discrepancy could be due to fear. Employees having heard stories from colleagues who have lost their jobs because of the disease.
Gosh, I'd like to think that employers would be supportive of their employees, but I guess that's not the case with all workplaces. What about treatment, Dr. Whitney? What kind of treatment is available, and are the available options somewhat influenced by the most common types of arthritis?
I suppose the treatment depends on the type of arthritis we're dealing with. You see, arthritis can be caused by several factors. No synovial fluid is delivered. This means that there are more than 100 types of the condition that affects people worldwide. Some examples are gout, osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, lupus, erythematosus, scleroderma, hypermobility syndrome, juvenile dermatomyositis, and fibromyalgia, among others. Even though the list is pretty long, the most common types of arthritis are osteoarthritis, as you said, and also rheumatoid arthritis. Having any arthritis is detrimental to someone's life. It does not depend on how common the disease is. The causes range from wear and tear at the joints, especially the knee, shoulder, and hip joint, to autoimmune destruction of the components of the joints, among others. In addition to pain in the joints, the typical arthritic patient also experiences inflammation in the joint characterized by redness and increased temperature. The decrease in range of motion and stiffness is also evident in such patients and acts as an alarm bell. During diagnosis, the signs and symptoms are basic, and all the healthcare professionals are expected to know the distinctive traits of each type of arthritis, if they are doing their jobs properly. This will assist doctors during diagnosis, especially in the terms of choosing the further testing, such as blood tests, to check for rheumatoid factors, X-rays, MRIs, and computed tomography, to help the healthcare provider to rule other causes of joint swelling and pain.
I see. Would you break down some of the types of the condition that we come across most frequently? I think our listeners would be particularly interested in how they are managed.
Sure. Take, for example, rheumatoid arthritis. This involves joints of the fingers and the hands and occurs due to body's immunity self-destruction, which ends up destroying the synovium that functions to produce synovial fluid. Synovial fluid is used for cartilage nourishment and lubrication. When the synovium is damaged, no synovial fluid is delivered. Hence, the friction at the joint is experienced, and the cartilage degrades and reduces in an amount resulting in arthritis. On the other hand, osteoarthritis is the most prevalent type and it involves the normal wear and tear of the cartilage. It takes care of the joints. When it is worn out or reduced in size, the bones are destroyed as well as the joints. Psoriatic arthritis happens due to psoriasis that affects the skin over the joints, making the joints to be inflamed, stiff, and painful. Lupus erythematosus occurs when the immune system starts attacking every tissue in the body. An individual often experiences pain all over the body, including the joints. With regards to management of arthritis involves both psychological, medical, and physiotherapy aspects. Medication